On this episode, we'll talk about the recovery after gastric sleeve surgery.
3, 2, 1.
Here we go!
Hello everyone, I'm Dr. Álvarez with Endobariatric.com, and today we will be talking about how is the recovery like after gastric sleeve surgery, and I will be focusing mainly on the diet phases because boy is it common for us to get that question is how is the recovery like regarding the diet after this type of surgery. The recovery from gastric sleeve surgery can vary greatly depending on the individual, but also on the guidelines, which are going to vary from practice to practice. But generally, it involves a gradual transition from a liquid diet to a solid diet over several weeks. So today, I am here to give you a possible recovery scenario or timeline focused on your diet that I know is going to be very helpful if you're looking into this procedure. So let's get at it. Day one, you will stay in the hospital for observation and, of course, pain management. You will be encouraged to walk, to drink clear liquids to prevent blood clots and dehydration. On day two, you will be discharged from the hospital. If there's no complications, you will continue to drink clear liquids and to take pain medication as prescribed. You will also need to be avoiding heavy lifting or lifting anything heavier than 10 pounds as a limit for your physical activity. Jumping to week one, you will increase your fluid intake to 64 ounces a day. You will also start taking your vitamins and your mineral supplements to prevent any deficiency. You will follow up with your surgeon or your dietitian to monitor your progress and adjust your diet plan. You will also need to avoid strenuous exercises or heavy lifting. Jumping to week number two, you will transition from clear liquids to full liquids such as protein shakes, soups, milk. You will also continue to take your supplements and pain medication. And you will also start to introduce some light exercise such as walking or biking, but no more than 30 minutes per day. Week number three, you will advance from full liquids to pureed foods such as mashed potatoes, scrambled eggs, or yogurt. You will also need to drink plenty of fluids and take your supplements. You will also increase your activity gradually, your intensity gradually, and also the duration gradually. On week number four, you will move from pureed foods to soft foods such as cooked vegetables or fish or cheese. You will still need to avoid certain foods that have high content in fat, sugar, or fiber, as well as carbonated drinks, alcohol, and caffeine. You will also need to continue now the exercise routine. You need to exercise regularly and follow up with your healthcare system. And week number 5 and beyond, you will start to eat regular foods, but in much smaller portions. Remember, that's how the sleeve works. You'll need to be chewing more and taking a little longer to eat. You're retraining to eat. You will aim to eat 3 balanced meals and 2 snacks per day with a focus on protein, fruits, and vegetables. You'll also need to be drinking plenty of fluids and between meals and not with the meals. And we've talked about that before. You will need to keep taking your supplements and, of course, your routine daily exercise. You will also need to attend certain support groups or counseling sessions if needed to help you control or help you with the emotional or psychological aspects of your weight loss journey. The recovery from gastric sleeve surgery can be challenging, but also it can be very rewarding. By following your healthcare providers and dietitian's instructions and making healthy lifestyle changes, you can achieve your weight loss goals and definitely improve your quality of life. I hope you found this information useful, and if you did, if you can leave me one of these, I'd greatly appreciate it. It will be very beneficial to our channel. And hey, don't forget to subscribe to our channel. That way we can hang out again. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.